It's hard to believe that it's already back to school time. It feels like the summer flew by. Several districts in our area are already returning this week. LAUSD is returning next week. So with 94% of all COVID cases in the U.S. being those that are unvaccinated, how worried should we be about sending our kiddos under 12, by the way, who are unvaccinated, back to school when they're still not eligible for the vaccine? We thought we would get some answers to some of your questions this morning. A great friend to our show, Dr. Buddiga, Praveen Buddiga, joins us now, board-certified immunologist. Good to see you again. You've been so wonderful and generous with your time. I know you're a busy guy, but we thought, you know, as kids are heading back to school right now in the coming weeks, parents are obviously concerned. Should they be?
Definitely. As a board-certified immunologist with a large percentage of my patients being families and children, I get this question so often. The truth is, if they are vaccinated, you don't have to be too worried. The Delta variant is highly contagious, but the Pfizer and Moderna shows effective rates of nearly 94% against the Delta variant. The Delta variant is much more aggressive than the original strain, and it is seeking to infect primarily the lung tissue and has a contagion rate of almost 9. That means one person can infect 9. And it's almost comparable to chickenpox.
So,
However,
but here's the concern, doctor. Under 12, they're not eligible for the vaccine yet. So what precautions can parents take as they prepare their kids to go back into the classroom? Obviously, they're going to need to wear masks, et cetera. But what other things are you telling those patients and those families of patients what they should be doing as they prepare to go back in the classroom?
Wearing a sterile mask that should be replaced daily. Try to avoid the cloth mask unless you're going to wash it periodically, and if periodically, you know, meaning every day, it has to be a clean mask. Also maintain social distancing and wash hands, and consistently, please avoid touching your face.
That's an important thing to tell our kiddos, and I think they've gotten pretty adept at that over the past year, right? They've learned some of these habits of the spacing and the hand washing and avoiding the face touching. Do you have any further update for us on how the trials are going in the vaccination for kids under 12 and when we might see a vaccine for them?
The Immunology Committee is actually anticipating a few exciting things that are coming about, that the FDA is going to give full approval in the next few weeks for the Johnson & Johnson, Pfizer, and Moderna vaccine, so they don't have to renew it every 90 days. And that will allow actually a vaccine mandate to be placed based on the safety data. Also, we expect that children in the age 5 to 11 will get an approval for the FDA, from the FDA for emergency use. So they will also fall into that group, and we'll have a vaccine for them. So I'm really excited about that.
Yeah.
Probably mid-October.
Okay. Okay. Look, we don't have at this point much hard evidence that the Delta variant is making children more seriously ill. So why is it so important that we get approval for them to be vaccinated?
Well, the reason is because the children aren't really getting sick yet. Viruses are constantly looking for a host to survive in their naive immune systems, and our concern is that as more population gets vaccinated, the virus will mutate to become more dangerous to the younger populations, because the virus is looking to survive in systems that haven't been exposed to it yet. We are just at the beginning to see the evidence that there's been a little uptick towards small spike in recent cases in transmissibility in the under 12 populations. We're monitoring really carefully and hopefully waiting for that vaccination to be released before it becomes a real issue for this children under 12. But my main message here is those who are eligible over the age of 12, please get vaccinated, because this virus seems to be targeting those who remain unvaccinated in this group.
You know, we have to address the hesitancy, the mistrust. We have people not relying on trustful sources. There's a lot of fake news around the vaccinations and immunizations circulating. Can you pass along a trusted source that you and your colleagues in the medical field rely on?
You can visit the CDC website, or you can visit the WHO for the latest numbers and statistics. But the medical community, the doctor community, the health professional community really looks, and the immunological community looks to the Johns Hopkins University website as a gold standard. We can think of them as almost like an advisory committee, looking overall at all the other data and looking at the positive perspective and bringing us a really highly accurate algorithm.
All right, Dr. Buddiga, you have been incredibly generous with your time again today. Please, you can visit if you have more questions. You can visit.
Just have one more comment, if that's okay.
You sure may. Go ahead, Dr. Buddiga.
Yeah. I feel this is my time in terms of, as a doctor, I feel incredibly passionate, and I know you asked me this question last time, that we really need to change our perspective about being vaccinated. I think we're getting to a place right now where we really can't see it only as a matter of personal rights. It has become more than us as responsible individuals, similar to us when we're flying in the airplane, when we're asked to get the oxygen mask or put the seatbelt on. I think it's really, really important, and then take care of our children as the next step. The only way we can get ahead of this and stop this epidemic, which is horrible and pandemic, is to do our part, get vaccinated for the benefit of everybody. We need to reach that golden threshold herd immunity number of 70 to 80%, and then we can return to normal life as we knew it. And if you want any more information, you can visit my website at buddiga.com.
Buddiga.com. We're doing it for the greater good. Thanks for your time, Dr. Buddiga, and your perspective. It's always valuable. Appreciate you.
Thank you so much, Michaela, for having me.
A joy.